Okay, we're good. We're live. Welcome to the EMS committee meeting, our first one in 2025. My name is Dan Interlandi. I'm the chair. We'll go through roll call. I'm a little rusty at this, so I apologize if I stumble a little bit, but let's go through roll call. Actually, is it the Pledge of Allegiance? I believe first, yes. So let's, those who can't stand for the Pledge of Allegiance.
We don't have a flag.
We don't have a
Do we have a
flag.
flag on the PowerPoint? No? Okay.
No, there is no PowerPoint. We don't do those anymore. So we can add that though. We can add it for next meeting.
I didn't even go crazy doing the entire agenda as a PowerPoint. I think all we did was put like that and then just a blank screen or like a title screen saying town EMS committee meeting or something.
Yeah.
So you could use a generic one the same one every time.
Trying to find a,
I would move on at this point.
okay, yeah, that's fine.
Been going off on my phone.
I tried.
Yeah.
Roll call.
Matthew Esposito present.
Dan Interlandi present.
Bill McCarthy.
Susan Walcama.
All right.
So there is a quorum.
Yep.
Right, so.
Approval of agenda. Everybody should have received a copy of the updated agenda sent out by DJ.
Oh, the agenda, yeah.
So somebody would make a
Motion
motion.
to accept the agenda as it lies.
Second.
Second, Bill, all in favor?
Aye.
Aye.
All opposed? Or abstained? Okay, pass. Next is public participation.
Anybody online?
Nobody's online.
Nobody's online? Okay, great. Minutes of the previous meeting. The ones I have are from April of last year. I can't believe we haven't met for that. Do we have any questions on the minutes or approval of the minutes from the last meeting?
Any discussion?
Oh,
Motion to approve the minutes?
So moved.
Any objections? Second.
Second.
Motion second.
Motion second. Told you I'm mercy at this. Passes. Next is reports. First, reports from Newington EMS. We have Chief Mangan here. Anything in particular?
nothing really. A lot of activity with the town, radio system changeovers. All positive, pretty much. And for us, not really too many changes. The good news is that we are working with AMR. As the radio rollout comes on, it's gonna be kind of seamless, I believe, for everybody, it's a good point. That's all I've got to report.
Okay, thank you, Chief. American Medical Response, anything?
Yep, good evening. Not too much going on. We're seeing a pretty big spike of calls in the last few weeks. We think it's just a lot of folks are sick with some respiratory and
There has been something
going around. Yeah,
even at work and whatnot.
yeah. Otherwise, it's our standard. We're in the process of doing some recruiting. We have a new hire class that's starting in a couple of weeks with some full-time positions and some full-time paramedics will be transitioning. But otherwise, I don't have anything else specific to add.
Thank you. We did receive reports from AMR from November for their times. I sent it out to, hopefully everybody received it for review. Does anybody have any questions or concerns for those times or anything they want to review? in keeping with that, I made a request to North Central CMed, which is the regional dispatch hub, for a copy of what they have for times for both Newington EMS and AMR, as well as the town system for the times they have. Nothing in particular that jumps out that's bad or anything. But as part of our responsibilities at some point or another was to make sure all those times are being well represented by both Newington Ambulance and by AMR. So they're getting to the calls when they need to be getting to the calls. So I just wanted to do, have the committee do its due diligence and check all the times and make sure that, everything, not everything is gonna sync up. Cause using the radio to call one dispatch is going to take a couple of minutes maybe from another dispatch. So there's gonna be discrepancies, but we're just doing our due diligence to check on that. So once I have all that information, I'll share it with the rest of the committee and forward it to everybody. But right now, we just get, and thank you, we get the dispatch records from AMR on a fairly regular basis. That's all we have for reports. Item 6, old business.
So now you'd make a motion, you'd ask for a motion to approve the reports.
Okay, then I will make a motion to approve the reports.
You're the chairman, so somebody else makes the motion in a second.
See, I told you, rusty.
Anybody else wanna jump in? I'm making all the motions.
Well, I'll make a motion to accept the reports as given.
Second.
I haven't done this chair thing in like 3 years, so cut me some slack, please. Thank you. Thank you, everybody who's watching. So any objections or abstentions? And the motion passes. Thank you. So now it's item 6, old business. I have the CAS system integration. I know Scott was working on it. There was kind of a hiccup.
Yeah,
You wanna-
town manager's been keeping us informed. We had to get, so basically we met with the town agencies, which be IT, and for dispatching, make sure we're all set. Everything's been done before in other towns, so it's just a matter of integrating it to basically this physical hardware, which is down police department. Unfortunately, last year when we had contracted with our healthcare report vendor, we started to work on it, but there was a lot of other shared work had to be done. And so our project was put on hold. I had a meeting yesterday with dispatch. We were talking mostly about the radio implementations, but we also were at dispatch center. And we were talking about how things basically with AMR have been working and them getting the updates and all that. And what they were very excited about is that when I can get my healthcare records integrated ESO, basically. Right now we're using image trend, but if we went to ESO, I don't need a third party. It's direct. So I'll have a better integration. The concern, or one of the, I don't want to say concern, but one of the items that was brought up by dispatch is to not forget that we could probably take the data that's being imported direct from AMR now. It most likely will be easy for them to integrate that into the ESO hub once that's installed. And that would bring us, I think, a full 360 degrees from the project we started a few years ago. So I've got a meeting Tuesday with the project manager at ESO. It's still about a 3 to 4 or 5 month, depending how much work needs to be done, integration. But it was favorable from both sides finally, in line. So I can't wait till I can tell the town manager that we're.
Yeah, the hope is the CAD to CAD link with AMR is working well for a while now. And with that, not only do we see AMR's acknowledging the call, responding and whatnot, we're actually seeing AMR. One of the things we discussed about questions of how fast NEMS is getting dispatched is sometimes AMR has a unit signing on before they even drop the NEMS tones, depending on how cooperative the caller is. If it's a difficult caller that takes time to try to work over to the AMR call taker, the dispatchers already have it in the queue and might be already dispatching an AMR ambulance to it while they're still trying to get the call taker to get the information out to AMR. So that's been working well. And we also see the EMD notes coming back through the CAD link. And the hope is to get the full 360 where those EMD notes will be viewable by the EMS crew from them. And that's the hope that we do see that, but that's
Yeah,
part of the
that'll
whole
help, I
project.
think. Pull everything together.
Yeah.
Because what's, basically what happens is, we're still being, because of the architecture, we're still being dispatched kind of the same way it was back in the 1970s. You dial 911, a dispatcher actually takes your information. With AMR, as soon as they input it to the computer, their dispatch center and their supervisor, and depending on who's in the crews, like I think Medic 3, who's assigned to the time, he actually sees it before a person at the dispatch center can take the time away from the phone call to call on the air. So once we get that wrap up, then it's not like it's delaying times. We're not seeing that in the reports. It's just, it brings us up to the 20th century.
So basically where we are now is everything's ready on the town side. We're waiting for ESO
Yeah.
to get up to date on their side.
Excellent. Any questions? And I know the whole dispatch thing could be daunting if you don't, if you're not in the know. Any questions on that? Okay. Thank you, Scott, for explaining that. I know you've been working on it ever since I've known you. Right, I don't see any other old business. So item 7, new business. Updating the contracts with the ambulance services and EMD. So Scott, does the town have a contract with Newington Ambulance?
Right now, the new town manager is looking at all contracts. And then that part of it is the building contract and the service contract. So we are, like we were with the LEMC plan last year, we're kind of in limbo. But it's an active project of the town manager and us. It's not, it's just, he's got a lot going to clean up.
So that's something that we should,
So it's on his agenda and it is progressing.
so we'll go back to that for our next meeting.
Yeah, we'll have to keep it as old business. Till it's-
When does our current contract expire or whatever?
Well, that one gets a little difficult. It's
Is it like an open-ended thing or?
it kind of is,
Yeah,
but
there's
there's multiple
ambiguities
levels to it.
between the contract for use of the town building and whatnot is clouded with the service contract. Service contract is pretty much like expired, but just being,
right, ours is. But Newington EMS, there used to be a 3-way town contract. So basically, AMR, Newington EMS, and the town used to meet, it was all in 3. There was a movement a few years ago that seemed positive to split that apart. So basically, AMR has a contract with the town, AMR has a contract with us, and we have a contract with the town, but AMR is not part of that. So, basically, AMR, the big contract that I think everybody always worries about is, I think, through 26,
Yeah, so the,
between all parties. So we're good with paramedics.
yeah, so we're contracted through July 1st, 2026 is the expiration date. That's for the daytime coverage and EMD as well as the paramedic.
Okay, so we're all set for that. Not expressing
Yeah,
issue
it's not
for.
a pressing issue.
Well, the one that's kind of in limbo right now is the agreement, because it was never a contract between the volunteer ambulance service, 6 to 6, and the town.
Yeah.
But I can guarantee you that the paramedic side of it, which is the big one for the local emergency services plan, is very, I think, strong through 2026. And so what will happen is, this is the one that, you know, it's kind of, it's one of those, it's a agreement that was written in the probably early 80s that just says the town would give us free use of the building if we provide ambulance service. And It needs to be updated.
Yeah, all right.
It's not like we're trying to change the levels of service. It would still remain the same.
Okay.
Any other questions for Chief Mangan or for? Thank you, Scott. Let's see, adoption of the 2025 meeting schedule. So last April, I believe we decided to meet quarterly. We can still do that unless somebody sees a need to meet more urgently. We can kind of keep it quarterly.
Having quarterly regular meetings.
Yeah.
You still allows you the opportunity to call special meetings
Right.
when there's work that needs to be done.
So I need to apologize. I actually did schedule a meeting for December, but wires got crossed somewhere and we kind of didn't, weren't able to put that together, which is why we're having the special meeting the beginning of the year. But moving forward, yeah, we will try to do it quarterly. Hopefully, I'll be more mobile as time goes on.
I think all we need to do is put together a schedule and file it
Yeah.
with James.
I have,
Yep.
I have it, I'll file it. So do you
Okay.
want January to be your first meeting?
Yeah, it's fine.
And then your next meeting will be
April,
April, and then subsequent.
right.
One more quarter, the first month of the quarter.
Yep.
Do you wanna, I think it was always the third Thursday.
Yeah. Does anybody need to change it from the third Thursday or? I think that's what we decided last time, so unless somebody has a,
Doesn't affect me.
doesn't,
Third Thursday, 6 p.m.
Yeah.
Okay. I will get that filed.
thank you very much. The last item C is the local emergency plan. We just finished this, didn't we? But I guess we were kind of a year behind. So.
Sorry, hold on. You have to make a motion to
I
adopt
have
the
to make,
meeting
okay, I have
schedule.
to make a motion. Well, I can't make.
A motion to adopt the meeting schedule as discussed.
Thank God you're here.
Sounds good to me. Second it.
All in favor?
Aye.
All opposed? Abstained? Passes. But yeah, the local emergency plan. So when it got adopted last year, last November, I believe, the town council meeting, we were a year behind.
Yeah, I think it's set in the
Yeah, it's
in the clerk's office for
Yeah, the
probably 6
committee-
months before
The
it
committee
went to
did their
council.
job. The committee did due diligence, had everything in place.
Oh,
It
yeah,
got lost.
yeah, it got lost with
Well,
everybody,
we
yeah.
had a changeover in the
Yeah.
council and it got
Yeah,
delayed getting put on the
yeah.
council agenda.
Yeah, I got paperwork too. That's fine. That happens. But we're kind of 3 years out from having to redo it again. It's every 5 years. We're 1 year behind. So there's something that we don't necessarily have to do this year, but you know, the earlier we start and kind of plan it, you know, we don't have to worry about delays. So I'll keep that under old business.
The only question I would have is, I know there's a 1, 3, 5 year goal cycle. I know that, and I think the first year was where the CAD was identified. I don't know if there's any other goals that need to be just reviewed.
We can certainly,
We could bring the document
yeah.
to the next meeting and look at what we need to
Yeah.
look at.
yeah, absolutely. So we'll,
Can you send it out to everybody?
yeah, we can send another copy out to everybody, absolutely. I know the state has it and they were happy that they got it. So I will send that out for the next meeting. Let's see what's next here. Right.
Information sharing.
Information sharings, or anybody pop in?
Nobody's online.
Okay, I tried to advertise it as best as I can, but. So no public participation, anybody for information sharing, anything that anybody has? The only thing that I wanted to add, I guess, when we go over these contracts or what have you, is I sent out the quality assurance process for both Hartford Healthcare and for Trinity Health or St. Francis. So the way it works is Trinity or St. Francis Hospital, along with someone from AMR's office, kind of looks at the documentation to make sure that things are being done the way they're supposed to be done and documented how they're supposed to be documented. Newington Ambulance does the same thing. They have a quality assurance officer, and it gets looked at by Hartford Hospital. Certain calls, strokes, heart attacks, calls where we use the defibrillator, all get looked at by the hospital to make sure that people are doing their due diligence. And I think as a town agency and as a town, we should be aware of these policies and these protocols. So I sent that out to everybody to digest it as they will. So that's the only thing I have. So not hearing anything else, move on to adjournment.
Make motion to adjourn.
I'll second that.
Excellent. All in favor? All right. All opposed? You sure? Okay, thank you, everybody. Thank you, anybody's watching.
Third Thursday of April.
Thursday of April.
Okay. Thank you, ladies and gentlemen.